As international aid actors, we immediately adapted our response, reducing the number of people physically present in these areas and making sure all staff were implementing prevention measures, such as wearing masks at all times and distributing masks to IDPs and other vulnerable communities as much as possible. We also quickly scaled up our support to the COVID-19 response, providing essential equipment such as ventilators, rehabilitating health facilities, and training thousands of health professionals. Tens of thousands of volunteers were recruited and trained to support the response and make sure that our collective efforts reach those living in the most remote areas. And very importantly, we did not stop providing essential humanitarian assistance to those who rely on us in order to survive. On the contrary, we scaled up our support to make sure sufficient food rations were distributed, access to water was increased, new latrines and hand washing points were also installed. As I already mentioned, health services were increased, new shelters were built, including COVID-19 quarantine shelters. Radios were distributed so that children could continue their education through pre-recorded lessons. And also, our protection services continued for women and children who were the victims of abuse. I would like to thank and applaud all of you and all of our colleagues on the front line of the COVID-19 response, working tirelessly for many months to address this unprecedented challenge. Efforts deployed by all are truly remarkable. That being said, we must not become complacent. This is one of the most important threats that we have faced as a global community in the 21st century. Nigeria may not be appearing to be facing a second wave of COVID-19 infections, as other countries are struggling with at the moment. This said, we are facing a very unpredictable future, and there are many things we are still uncertain about regarding the COVID-19 pandemic and how it spreads and how we can best prevent it. Nigeria will face a devastating impact, however, in the months and years to come from the pandemic on its economy as well as on its social fabric. As we have seen, prices on critical commodities have increased, and today millions of people cannot afford to buy food. Millions have lost their source of livelihoods. Hundreds of thousands of women and girls will live with the scars of domestic violence and abuse. Tens of thousands of children may never go back to school unless we are providing alternatives for them. The pandemic will have an enduring impact on all aspects of society, and today we're only seeing the tip of the iceberg. I believe that today's colloquium is critical to help us prepare and act over the coming years. COVID-19 and the consequences of the pandemic, I'm afraid, will be with us for many years to come. In your discussions today, I think it's really important to look at the lessons learnt, the best practices that we have been able to identify, and also to clearly identify the factors that we can or cannot influence. And most importantly, how we will mitigate those risks over the coming months. Despite our collective early efforts, some communities suffered from long delays in assistance delivery. Disruptions in the global supply chains were beyond our control. Such elements needs to be featured in our reflections today so that we are better prepared for the challenges to come. I assume this will also be a challenge in terms of how we go further in terms of then acquiring and distributing vaccinations when they become available. And I also invite you to look at the opportunities that we have in terms of building back better. The opportunities in terms of smarter delivery, in terms of being able to make sure that our meagre resources go further. The disruptions and negative consequences of the pandemic are now a space for us to build bridges, reinforce our partnerships, build new partnerships, as well as creating new opportunities. This also means that we should be thinking beyond temporary solutions and look at more sustainable solutions in terms of the humanitarian response in the coming months. Having sufficient resources as well as access will remain major challenges in the coming months and in 2020 on. And I'm hoping and I'm trusting that 2021, so I'd like to thank you all and wish you all the best for fruitful deliberations today. And I will be looking forward to be hearing the results of this review and also your proposals for ideas in terms of how we should be working in the months and years ahead. Thank you very much.
It is my utmost pleasure to be here today with stakeholders that shaped the humanitarian response during the COVID-19 pandemic. I'm confident to acknowledge that in your various capacities and mandates, your assistance provided humanitarian interventions to vulnerable Nigerians. You demonstrated resilience in the face of tremendous challenges and risks. Ladies and gentlemen, it should be noted that the COVID-19 pandemic reinforced the reality of the multiplicity and complexity of humanitarian needs during the crisis, as well as proliferation of new actors, forms, and modalities of response. Likewise, it must be noted that humanitarian perspectives and practices are broadening from just catering for basic survival needs to providing durable solutions and sustainable development for the vulnerable. In its intervention, the Ministry of Humanitarian Affairs operated with a multifaceted approach with due focus on the most disadvantaged and vulnerable of society, including refugees, IDPs, and various categories of persons of concern. The operative mechanism of targeted social interventions with context-specific approach of the ministry's COVID-19 response committee pulled in all the agencies supervised by the ministry in a coordinated collaborative strategy of delivering as a unit. As observed from the experience of the COVID-19 response in Nigeria and globally, it is obvious that traditional institutions, that is state and non-state, international or local, must work coherently to avoid unhealthy practices and duplication of action. Response must be hinged on the nexus of humanitarian action, sustainable development, and peace to address vulnerability and guarantee resilience. As the coordinating ministry for all national and international humanitarian action in Nigeria, we have invited you to this one-day colloquium to share experiences and peer review humanitarian interventions during and after the COVID-19 lockdown in order to adopt best practices of lessons learned. The expected outcome should be a strategy to build resilience before, during, and after pandemics and disasters. Ladies and gentlemen, it is therefore expected that the technical session of this colloquium will highlight hits and the misses in our collective and individual endeavors during the COVID-19 response and thereby profile a comprehensive way forward. The proposed strategy is expected to feed into the ministry's framework of collaborative engagement for effective and efficient delivery of national humanitarian management with direct and sustainable impact on any Nigerian made vulnerable due to the crisis. Ladies and gentlemen, once more on this note, I declare this colloquium open and wish you very, very fruitful deliberations. Thank you very much for your time.